The question and answer session will be prioritized for reporters, and then we can open it up to some of our advocacy volunteers who've joined the line as well. During the Zoom meeting, your microphone is going to be muted until you are invited to speak. We also invite you all to keep your videos on so we can see each other, know who's on the call with us, feel a little more homey. And then also let you know that the chat box is limited to writing messages directly to hosts, and basically staff and volunteers of the meeting. You'll see in the chat box, there's a name, Rachel Questions. If you have a question, you can direct it right to Rachel, and at the end during Q&A, she will be pulling people live. If you are invited to speak, you'll get a little blue button that pops up that says the host has asked you to unmute. So you would just click that button and then you'll be live with us. So with that, I'm going to get us started. And again, thank you all for joining us today on this really important and critical issue that are facing New Jerseyans. Across the state, Garden State residents should not have to choose between filling life-saving prescriptions, paying rent, buying food, and meeting other critical needs. In 2017, nearly 1 in 4 New Jersey residents stopped taking prescription medication due to cost. Drug companies are making billions in profit off seniors and taxpayers. New Jersey families face the 1-2 punch of the pandemic and skyrocketing costs. And with the pandemic causing widespread unemployment and subsequent loss of health insurance, drug companies' high prices are hitting New Jerseyans even harder. In fact, in June, Gilead announced that remdesivir, a coronavirus treatment, will cost more than $3,000 per patient, at least 33% more than the company would charge anywhere else on the globe. US taxpayers helped to fund remdesivir's research and development to the tune of nearly hundreds of millions of dollars. This is simply unacceptable. New Jerseyans should not have to pay the highest drug prices in the world. The AARP conducted a poll among 1,200 New Jersey registered voters 18 plus between November 18th of 2019 and December 8th of 2019. So this was before the pandemic, to find out their opinions on the cost of prescription drugs. But as we talked about, the pandemic has just, along with everything else, exacerbated the need for us to take action on prescription drugs and the really pain point that people are experiencing right now. So I'm going to go through the results of the poll with you. Again, this was a poll of New Jersey registered voters 18 plus on their opinions on prescription drugs. So of the respondents, a majority are taking prescriptions on a daily basis and are concerned about affordability. 79% of registered voters 18 plus reported that they have taken a prescription drug in the past 2 years or live with someone who has. 86% of those who reported someone in their household has taken a prescription drug in the past 2 years also indicate that medication is taken on a daily basis. 74% of registered voters 18 plus in New Jersey believe that consumers pay more for the same prescriptions in the United States than in other countries. And then you'll see over here in the chart, the level of concern about being able to afford the price of prescription medications in the future. And if you take a look at very concerned and somewhat concerned, more than half of people really have concern about being able to afford their medications. Respondents were also asked about their views on pharmaceutical companies and their question about whether they were more concerned about profits versus concern for helping. So among those registered voters 18 plus, nearly 3/4, 74%, believe that pharmaceutical or drug companies are too concerned about making a profit and not concerned enough about helping people. 19% believe pharmaceutical or drug companies are concerned with both equally. The majority of respondents, regardless of political affiliation, also believe that elected officials are not doing enough to address high prescription drug prices. So regardless of their party affiliation, the vast majority, when asked whether elected officials are doing too much, too little, or just enough to address the high cost of prescription drugs, more than 3/4 say elected officials are doing too little. And you can see it's really, pretty standard across political party there. Also, regardless of party affiliation, 80% of registered voters feel that pharmaceutical companies have at least some influence over the governor and state legislators in New Jersey. And so they really are taking a look at this and wondering how we are going to see next steps happen. And then finally, we asked questions about specific proposals. And nearly all of the respondents said that they would support proposals to cut prescription drug prices. So they were asked if they would support the creation of a prescription drug affordability board to look closely at the price of prescription drugs. The board would be appointed by elected officials and would have no ties to pharmaceutical companies. And you'll see here that across party lines, you know, on average, 84% support the creation of a prescription drug affordability board. Respondents were also asked if they would support enabling the state legislature to allow the state to create an FDA-approved program to import prescription drugs from Canada to help save money on their medications. And again, across party affiliation, there's very overwhelming support for this initiative as well. And so we'll also share the fact sheet that really lists all of this information. But I really want to focus in on the fact that 84% of registered voters in New Jersey support the creation of a prescription drug affordability board, cutting across party lines. Senator Singleton and Senator Weinberg, both here today, are champions of legislation S-1066 that would do just that in New Jersey and really take a huge step forward in creating a space where New Jerseyans can afford their prescriptions. S-1066A 4218 is the companion, would establish a New Jersey Prescription Drug Affordability Board, which is an independent body that evaluates drug prices and sets limits on how much certain payers, including state agencies, will pay for high-cost prescription medications. A Prescription Drug Affordability Board will help ensure pricing decisions are reasonable, justified, and support improved consumer access and affordability. This would be a crucial step in reining in prescription drug prices. There is no reason why New Jerseyans should pay higher prices for medications here than anywhere else in the world. AARP has been tracking drug prices for 12 years, and year after year, the price of prescription drugs continue to increase much faster than inflation. This is because Big Pharma sets its own prices. And this poll shows overwhelmingly that across party lines, New Jerseyans want our elected officials to take action to reduce drug prices, and they support a New Jersey Prescription Drug Affordability Board that would do just that. Now, in the face of the health and economic crisis brought on by the COVID-19 pandemic, it is more important than ever that we take action. There is no reason why anyone should have to choose between filling prescriptions or affording essentials like groceries or utilities. And so with that, I'm going to invite Lisa Matthews and Jared Schechtel, who are from Neptune and would like to share their testimony about what it's been like to struggle with the high cost of prescription drugs. So I'm going to turn it over to Lisa and Jared.
Hi, I'm Lisa Matthews. My son Jared Schechtel and I are here to discuss how out of control prescription drug prices concern our family. In April 2017, my son Jared Schechtel was in the hospital, and at the time Congress was discussing repealing the Affordable Care Act. He was on Remicade infusions for Crohn's disease, and he was newly diagnosed with a neurological autoimmune disease. We were also visited in the hospital by a representative from his insurance company, which led us to inquire about the cost of his hospital stay. And that bill, we found out, was over $600,000. So I began to wonder how Jared would get medical insurance if the Affordable Care Act is not in place, allowing him to be on his father's insurance and protect against pre-existing conditions, and how he could pay for the medication he needs to treat his autoimmune diseases for the rest of his life. I reached out at the time to state and federal representatives, and some of our Democratic legislatures responded with care and concern. At the time, they let us know that much needed legislation was being worked on to try and bring down the cost of medication. Currently, the cost of Remicade is our family's greatest concern, but all prescription drug prices fluctuate, and there are no assurances of having drug insurance coverage forever. As Crystal said, we shouldn't have to pay the highest prescription drug prices in the world. New Jerseyans are counting on our lawmakers to help make their medications more affordable, and it's time that our elected representatives lower prescription drug prices for everyone. Now I'll pass this over to Jared for him to discuss his case. Thank you very much.
Hi, I'm Jared Chichtel. We're currently in Neptune, New Jersey. We moved here about a year ago. We used to live in East Brunswick they lived there for over 22 years, but me, 22 years. And I've been hospitalized and going to the hospital at Robert Wood Johnson pretty much my entire life. In 2013, I was initially diagnosed with Crohn's disease. I missed pretty much my entire sophomore year of high school because of that. Constantly medicated. I was on probably 6 different medications at the time at 15, 16 years old. Aprezo was one of them, which costs about $6,500 a year. I know in other countries it's only about $2,000. That worked for about a year and a half until it didn't, where then I had to start going on to Remicade infusions. Remicade infusions currently we're billed about $205,280 a year for. Luckily, because of insurance, we can pay significantly less, but it's still a substantial amount that we're paying for it. I know that in Poland, it is actually $20,000 less for each Remicade infusion. And since I need them every single 2 months, and each one costs $34,000, it just kind of takes a toll both financially and emotionally, especially on me as I get older. I'm off my parents' insurance plan and I have to start taking care of myself soon. In 2016, I was diagnosed with a disease called opsoclonus myoclonus with ataxia syndrome. It's also known as Kinsborn syndrome. It's an autoimmune disease that's neurological. They're just starting to find out some things about it. It's about a 1 in a million case. Maybe 1 in 10 million. But with that, I've been hospitalized about 5 times for it, each bill costing about $200,000 to $600,000 per hospitalization. They initially put me on IVIG infusions for that to see if it could keep it under control. IVIG infusions cost about $10,000 per infusion, and you actually get 5 of them in a row every 3 months. So in total, that's also about $200,000 annually. So I'm not on that anymore, but if we were on that plus the Remicade was about $400,000 to $450,000. And that's just the medication itself. That's not paying for the nurses, the pre-meds, the hospitalization, anything that comes with it. So just the medication itself is such a substantial hit to me and my family currently. And that's just my main medications that I've been on. With that, you also have the pre-meds. I'm on IV Tylenol, which is a little to $40 to $50 every time. Then I have Lexapro, which is the anti-anxiety and depression medication that I'm on because of my OMS, which is about almost $1,000 a year. I also have to be on Clonidine, which I can barely sleep anymore because of my disease as well, which is about $200 a year. And then at the same time, there's other medications that have to come with it because of it. Back in 2018, on Thanksgiving Day, actually, I was being released from the hospital. I had a Shiley catheter in my neck with a direct port to my heart pretty much. And when they took it out, I threw a blood clot. When that happened, my heart drained all of its blood, my lungs collapsed, my liver failed, my kidneys failed. So that, first of all, increased my hospital stay. And then at the same time, I ended up on Eliquis, a blood thinner, for about 6 months, which that ended up costing about $1,600. So really, we take a look at it, they start stacking. I mean, even without these major infusions that I've had and I still am going through, they just stack and stack and stack and stack. And when I compared the prices to the rest of the world, it's insane that we're about 3 times more expensive than the rest. Thank you.
Thank you, Jared, and thank you, Lisa, for taking time to join us and share today. I know that other families around the state and around the country, share similar feelings, and balancing all of the multiple healthcare needs and prescriptions, and then on top of that, figuring out how to afford all of them is just a burden that no one should have. So next up, I'd like to invite Senator Troy Singleton to speak with you all today. Senator Singleton represents the 7th Legislative District in New Jersey since 2018, and prior to that role served on the Assembly from 2011 to 2017. He currently serves as the chair of the Community and Urban Affairs Committee, vice chair of the Economic Growth Committee, as well as a member of the Joint Committee on Housing, Affordability, Budget, Appropriations, and Judiciary. So Senator Singleton is just such a leader and champion on reducing prescription drug costs. He is the prime sponsor on introducing priority legislation for AARP, including a bill to establish and S1066, which we've been talking about, the Prescription Drug Affordability Board, and also S1067, which would allow New Jersey programs to negotiate through bulk purchasing of prescription drugs. And we are just so thankful for his leadership and for him making time to join us today. Senator Singleton, I'll hand it over to you.
Thank you, Crystal, for that kind introduction. And I want to thank all the members for their continued advocacy on this very important issue. Lisa and Jared's story, which we heard about, unfortunately isn't uncommon. And with over 1 million residents unemployed during the shutdown related to the pandemic, people oftentimes face the decision of choosing which was more important, keeping a roof over their heads or feeding their families or paying for their prescription drugs. And this isn't just simple rhetoric. These are conversations that I and my staff have every day. And we know this is especially a hard concern for our senior citizens on fixed incomes. I often say that paying for necessary prescription drugs has become somewhat of a Hobson's choice in our state, with patients deciding to pay for medicine or to go without so they can afford other expenses. And frankly, in the richest nation in the world and one of the wealthiest states in America, this is unacceptable and simply unconscionable. No one should go to the poorhouse because they had the misfortune of being sick. So to address these issues, earlier this year, I and my dear friend, our Senate Majority Leader, Senator Loretta Weinberg, stood with our friends from Citizen Action and AARP and introduced legislation that would create a prescription drug affordability board. Now, this legislation is based on a successful law that was passed in Maryland. And what it does in a few short words is the board would conduct a study of the pharmaceutical distribution and payment system, as well as examine what other states are doing to lower prescription drugs. The study would be related to also the generic drug marketplace. It would identify pharmaceutical products that have created affordability challenges for New Jersey residents, determine whether to conduct a cost review of those prescription drugs that were likely difficult to afford. And the board would also determine if there's a need to establish an upper payment limit on certain products, or whether or not to allow the importation of certain pharmaceuticals from other countries. Senator Weinberg and I both believe that it's long past time for us to be more aggressive with making sure that we really lower the cost of drugs, not just lower the payment, but lower the cost of drugs. As was talked about in proposals that I've done for almost since my inception into the legislature. One of the things that oftentimes drives me nuts is that when we use taxpayer dollars to help partially fund some of the research, and then we in our country are paying more, and Jared eloquently laid that out, that is something that has to stop. And the ability to utilize it as a holistic review, which the pharmaceutical board is intended to do, the Prescription Drug Affordability Board is intending to do, we think we'll have a real opportunity to lower and put some downward pressure on pricing. I thank you for this opportunity to continue to talk about how important this is and to continue to advocate for it. I thank the advocates for never losing sight and never losing the drive to push us in the legislature and push the governor to do more on this effort. We can and we need to do more And hopefully is now with this study that has been done will demonstrate the will of the people is behind us, amplified to do more. So thank you.
Very much, Senator. And we will continue to stand with you and fight with you to make sure that this legislation becomes a reality and we really can make a difference for people in New Jersey. So thank you again. I'd like to now invite Senate Majority Leader Loretta Weinberg to speak with you all. Senator Weinberg was elected to the New Jersey State Senate representing District 37 in 2005. She is currently the Senate Majority Leader and also serves on Senate Judiciary. She is a vice chair of the Legislative Oversight Committee, vice chair of the Select Committee on New Jersey Transit, and serves on both the Joint Budget Oversight Committee and Joint Committee on Economic Justice and Equal Employment Opportunities. She is also a strong champion on so many issues, and really in particular today of helping to reduce prescription drug costs for all New Jerseyans. She is a sponsor of S1066, again, which would establish the Prescription Drug Affordability Board in New Jersey, and is fighting to ensure that prescriptions are affordable and accessible for all in New Jersey. And so, Senator Weinberg, I will hand it over to you.
Thank you very much, and thank you for putting together this press event and an event that advocates can talk to us firsthand about their experiences. I also want to thank the prime sponsor, my colleague, Assemblyman Troy Singleton, for the privilege of working on this particular potential legislation with him. You know, you all know New Jersey is known as the medicine cabinet of the world. And that is because we have so many drug companies whose offices are located here in New Jersey. We're glad to have them. We are glad to participate in research to find new pharmaceuticals which keep our residents healthy and with long years ahead of them. Having said that, it makes it an even more difficult atmosphere in which to really understand what is going on here. Why should a given prescription cost less in Canada than in the United States, than in New Jersey? This legislation, I believe, will go a long way to actually translate for the public and for our, most important, for our policymakers, what it is in the landscape that creates these inequities, that creates what Jared told us about, that you can get a given prescription in Poland for much less than you can buy it here in New Jersey. So I think this is a really giant step forward. I look forward to passing the legislation and then to following what this prescription board will study, will share with us about how we can correct the inequities. I want to point something else out about the polling that was done. I know it was done by AARP, but it obviously was not just done of senior citizens. They polled, I think the universe was 18 plus. So this is across the age bracket. Don't think because it was sponsored by AARP, it's just about seniors. It is across the age groups in our state. And I can still remember, I'm going back a number of years, for the prescription, the PAD program, the prescription assistance for seniors and developmentally disabled. When we raised the copay on that in the state under prior administrations, we actually had testimony where people came and said they were taking half the prescribed amount in order to make their prescriptions last longer. And I'm sure that's going on in New Jersey, today as we speak. So to Troy Singleton, to AARP, to Citizen Action, to all those out there, to the advocates and the people who have been courageous enough to share their stories, this is a giant step forward, and I'm looking forward to participating in getting it passed. Thank you for your advocacy. Thank you for continuing to bring light to the issues that are important to the people who live in our state.
Thank you very much, Senator. We really appreciate all of the work you all are doing to get this through the legislature. We have one more speaker today who's going to share his story, Gary Weiner of Franklin Park, who I think will touch on some of what you talked about, Senator Weinberg, about being able to manage medications, you know, in a way that helps him kind of financially be able to make it through. So Gary, I'm going to hand the mic over to you.
Thank you. Thank you so much. I think I'm a typical consumer of medicines and prescriptions in some ways, and maybe not in some other ways. When you're young and healthy, you don't tend to think about prescriptions very often. And when you get a little older and something happens, that's when it becomes, it hits the spotlight. Unlike the story we heard earlier, the young man's facing a lifetime of possible financial disaster and health disasters. I didn't have to face mine until I was about age 57 when I had my first illness, and that was a heart attack. And I was diagnosed with diabetes at the same time. Those illnesses and drugs stay with you for the rest of your life. And my wife and I, my wife's also a disabled person who takes prescription medicine, between the two of us, we take over almost 24 medications. I take 13 every month, and the costs range from low to moderate to exorbitant. Jared mentioned something about Eliquis. I take Eliquis as well. Runs me about $300 a month for that particular drug, and overall, we spend about 30% of our income at this point of our life on medication and doctors, and again, that's not going to go away for me. It has become almost a full-time job to manage my medications, and when I say that, I mean that every month I have to look at where I'm going to get my medicines, how much I'm going to actually take, as Senator Weinberg said. Cutting back prescription drug use is not a smart thing to do, but sometimes it's a necessity to do. There's one particular drug that I take 3 doses a day, every day, which means I take 270 pills over a 90-day period. And when I cut out some of that medication by skipping a dose here and there, I can stretch a 3-month prescription drug to last me for 4 months if I do it that way. And I do that also by pill splitting. Some pills have scores on them that allow you to split a pill, and the dosage can be taken at half dosage. And I do that occasionally too, in order to stretch the finances. And it's not the smartest thing in the world to do. And my doctors would tell me that I shouldn't do it, but I do it anyway because that's the way finances have to roll here. I believe that when it comes to shopping around, I have to go to different pharmacies because not only are the prices different in Poland and in Canada, they're also different right here in my neighborhood, depending on which pharmacy I use to shop for. And even though I'm on Medicare and the prices are set every year on these drugs, they change every year. And as was stated earlier, they've been going in only one direction since the years I was diagnosed when I was age 57, 15 years ago, and that's up. And it's not making things better because as a retiree, and I had to retire early because of my illnesses, I am on the quote unquote fixed income. And every year it gets more and more difficult to manage it. Unfortunately, I have not sunken into bankruptcy, but bankruptcy through medical costs is the #1 reason why people face personal bankruptcy today. And I always have said to myself that I could be just one illness away from a bankruptcy. recently, in the last few months, I was diagnosed with thyroid cancer, and I had my thyroid removed. I'm fortunate to say that when you have your thyroid removed, it usually has a good outcome. However, by doing so, I have been facing additional medications that have come into the play. And at this point, I'm still trying to find out the proper dosage and frequency of those medications through my doctors. So I really don't know what that's going to wind up costing, but I'm going to be facing that forever, because without having a thyroid, you need to replace certain items in your system to help you function and survive. And I'll be facing that. And that's, I think, one of the things that people have to remember. In most cases, if you have a serious illness, it's not going to go away. So these medications become part of your everyday existence. And when it does, it scares you, both from your health perspective and from your financial perspective. I think that's why it's so important that Senators Singleton and Weinberg are getting involved in this. And believe me, I'm very grateful if anyone can do something to, if nothing else, lower the cost and manage the costs for people. And it becomes more and more of an issue, as I said, for older people, but that's not to overlook those people who are younger who are sick. It's just that when you're younger, you tend to be more healthy and think of yourself as being immortal. But we all have to face the fact that one of these days we're going to be needing some medical attention, and that is going to be a very costly thing when you're a senior citizen. No one should have to make the choices that sometimes I have to make, which is, whether or not I'm going to buy the food that I actually need, because I have to eat healthier, and it's more expensive to eat healthier than it is to eat less healthy. And I have to sometimes make that choice as opposed to the medication choices that I'm making. It's great that we have all these great drug companies here in the state of New Jersey, and they're all producing wonderful drugs. But the drugs themselves are not going to cure anybody's disease if you can't buy them and afford them. And that's the main issue that I face today. And I'm pretty sure to say that a lot of seniors and a lot of other people in the state of New Jersey are facing. I think that's basically all I wanted to tell you, but I don't want to sound like it's death is on my door. I know that I have a lot of diseases, but I also am appreciative of the fact that I can get the medicine. And I feel very badly for those who don't have that opportunity. Thank you.
Thank you so much, Gary, for taking time to share with us. And I think overwhelmingly, through the poll, through the comments that you heard today from both individuals, our legislators, that we need to take action. People should not have to live in fear of bankruptcy or fear of not being able to get access to the medications they need to survive. And so we look forward to working with all of you as we work to find some solutions in our state legislature that can really help New Jerseyans get access to more affordable prescriptions. And so we are going to be opening it up for questions now. If you look in the chat also, Rachel, our communications director, has included a link to the fact sheet that has the results of the poll, so you can all access it there. And I'm going to ask Rachel, do we have any questions from the media first for any of our speakers?
Yes, we have one question from Lilo Stainton from NJ Spotlight News. So I'm going to unmute her now so she can ask her question for Senator Singleton. So I'm not sure. She doesn't seem to be able to unmute herself, but her question for Senator Singleton was, what's the status of the bill that you mentioned, and do you have leadership support to move it soon?
So the status of the bill is that it's in the Senate Health Committee. I have a meeting set up with the Senate Health Committee chair to impress upon him the urgency of this bill. It's good that my co-prime sponsor and dear friend is a member of leadership, our majority leader. So I know her advocacy will be paramount in helping to move that forward. So it's my hope that in short order, we'll be able to advance this legislation. It has lingered for far too long. I know COVID interrupted some of the sort of normal processes in which we have here, but I'm hopeful that we'll be able to get some movement at least before the end of this year.
I just want to add something. I know I'm not a tall Irish guy, but the last I looked, I am part of leadership. So hopefully I will be able to advocate and that leadership will be on board.
Thank you. We do have another question from Michael Diamond at the Asbury Park Press. Michael, do you want to ask your question?
Hi, everybody. I want to ask Senators Singleton and Weinberg, I wonder how far a advisory panel could go in terms of price controls. I mean, I imagine your hands are tied with like federally insured plans, but what sort of impact would this make on prices?
So your point is well taken. ERISA plans are in a category where the state is not permitted to regulate those ERISA plans. But I feel confident that if the board were to be set up and the board were, through its metrics, were to establish that the upper payment limit, similar to how the Maryland example was, because that's where the law is sort of shaped off of, that we will have a significant impact in being able to put downward pressure on the pricing. Because I think once that data is collected and once that data is put out there, then the legislature and through all the entities that are purchasing will be able to have sort of the sort of data-driven argument that will allow us to do that in a substantive way. So that would be things like the bill talks specifically about state spending under the state health benefits plan, the school employee health benefits plan, Medicaid, family care, senior gold, PAD, et cetera. By being able to loop all that data in because of the purchasing power of the state in that regard, we'll have the information that allow us to put that downward pressure on the pricing for those entities.
And I think Troy outlined that quite well. And it is not only the pressure on the pricing, but it's getting the information out there. And I think the transparency aspect will also help change the landscape a little bit.
Thank you. Thank you.
Thanks.
This is Crystal. I would just add that one of the things that we at AARP, and I know our partners and other supportive organizations like New Jersey Citizen Action, are very excited about the fact that the board may have the opportunity to set an upper payment limit. And so we'll have the transparency to know, well, how much are New Jerseyans paying compared to other states, compared to other countries? Because right now, there's no one's job to actually take a look at what we're being charged and why. And so being able to take a look at that and say, well, hey, this is not affordable for New Jerseyans, and we're going to set this upper limit on what New Jerseyans will pay, will really help to start getting at what's coming out of our pockets and making sure that prescriptions are more accessible and more affordable. So it was a good question. So Rachel, I'll kick it back over to you.
Yes, thanks. We have another question from the press from Elizabeth Myers, who's an editor at Tap Into. Elizabeth, you want to ask your question?
Thanks. Actually, I have sort of three questions for Senators Weinberg and Singleton. One is, do you know if there is a similar board in other states like this?
Maryland.
Maryland?
Mm-hmm.
Okay. And I know Lilo asked about legislative leadership. Have you had any conversations with the governor's office?
Yeah, I did. This is a great question. So the governor's office has been made apprised of this bill, has closely monitored this bill. So they've been engaged in the conversation. But like many and most governor's offices, they don't comment on legislation until it gets to their desk.
Okay. Okay. And my last is sort of COVID-ish related. No, COVID related. A lot of the folks we've heard from have trouble getting access to intensive for their daily
There's
medicine.
some kind of background noise, so
Okay,
it's hard to hear.
Well, I'll talk a little louder. So, you know, folks are saying they're having trouble paying for their daily medications, but are you concerned that when a COVID vaccine becomes available, that is going to also be prohibitive for them to get access? Especially a lot of these folks are in the vulnerable populations and really need to have that vaccine first. We haven't seen a potential price, but, you know, is there any chance that this board would also look at access to the vaccine?
Well, I will tell you the way the bill is structured as of now, and the bill was written pre-COVID. The way the bill was structured as of now was to look at sort of what drugs were the higher cost drivers to our system. And that's sort of how the legislation is constructed right now. Your point, though, and which I think also is an excellent one, the idea that we're going to have a vaccine, if we are not making sure that a COVID vaccine is not affordable for everyone, which is a broader conversation, bigger than just this legislation. It can be widely disseminated, but we have to make sure that it is also affordable. That is something, quite frankly, that I think the leadership from our federal government has to ensure. It has to ensure that there's a plan, not just for availability, but also accessibility based upon price. And I know from having spoken to Senator Weinberg and worked with her for years, I know she will be making sure, and I will be right beside her, making sure that in New Jersey, we're making sure that it is not only accessible, but also affordable. And for us, whether it's in the construct of this legislation or just in other vehicles we have from our soapboxes, to make sure that happens, I know we will not shrink from that challenge to do that.
Thanks.
I concur.
Wonderful. And Rachel, did we have any more? Oh, she's messaging me in the chat. So that is all of the press questions that we had for today. And so we really thank you all again for joining us. You will be hearing more from everybody on this call as we work to make sure that we figure out how to lower prescription drug costs in New Jersey and to pass this bill that will establish a prescription drug affordability board. And so we invite you to reach out to us, to continue to work with us on this issue. We will be continuing to stand alongside Senator Singleton and Senator Weinberg as this moves forward. And look forward to continuing this conversation as we move this fight forward. So thank you all for joining us today. And I guess we'll be talking to you soon.
Thank you. Thank you.
Thank you.